Hi, I'm Phil.
Hi, I'm Esther.
So today we're going to talk about the burning sensation that some people can get in the front of their foot. So if you look at the picture here, that burning just below the toes or even into the toes is a common problem that we see every day. So Esther, how about you mention the first thing that we always check for if someone has that feeling in their foot?
Yep. So the first thing that we check for is just to make sure that they don't have any peripheral neuropathy. So basically damage to the nerves that can be caused by chronic diabetes or uncontrolled diabetes. Yeah. Another cause could be related to Phil, did you want to take over?
Sure. So what we can also see is a problem that causes pain there due to compression of the nerves between the bones at the front of the foot. So if we've ruled out diabetes as a cause of your symptoms, then that can be something else that we can see. Now I'll see if I can find, here's the picture I'm looking for. So what can happen is the nerves between the toes or just behind the toes can get aggravated. Now this doesn't take days or weeks or even years. It usually takes a few decades to develop into what we call a neuroma. So a neuroma is a thickening of the nerve and the paranerve tissue that ends up with a situation where you feel a burning, really deep burning sensation between the toes, in the forefoot that can spread out to the toes. Now it often starts just as a feeling of a little bit of a lump or a bit of a click that you can sort of feel there, but then as it gets bigger, it becomes really debilitating.
Yeah, it can be quite painful. I've seen it in a few patients who are runners or hikers as well, and really, I guess, active people as well. But also, I've found people who have got really flat feet and they're on their feet for a long time, like in hospitality and things like that, not wearing the right type of shoes either, so that can cause it. Yeah,
we'll generally find there'll be a biomechanical cause. So biomechanical meaning the mechanics of the body, the way the body moves, and the compression of that nerve, as soon as we have a look, we'll generally find a cause for why that has developed over a decade or two. So if we think it's this problem, often we'll do some imaging studies. So what would be the first things that you usually do to confirm your suspicion that it might be a neuroma, Esther?
Yep, so I would write a referral for an ultrasound to be done, just to confirm if it is a mordant neuroma or intermetatarsal bursitis, which is inflammation of the bursa. And so that will help us to confirm the diagnosis, basically. It's that.
And once we know exactly what it is, we have so many good tools in our arsenal. So the first thing that we usually look at, because it's a biomechanical issue that's developed the compression on that nerve, we need to consider modifying the way the foot works to reduce load on that area. And for a lot of people, I'd say probably 60-70% of people, getting a wider shoe and often using an orthotic to support the foot. So if we look here, here's an example. There's a particular metatarsal dome addition that we can use to basically spread the bones apart, prevent those bones from compressing and pushing on the nerve. Now that's a big part of what we generally would do, but then we've got other treatments, hands-on treatments we can do in the clinic to really help reduce the inflammation and to kickstart the healing process. So what are some of the ones, what's your favourite, Esther?
I've got a few, Phil. So I've got, so I like to use a bit of dry needling, shockwave therapy, and laser as well, to help settle the inflammation down as well.
And these are treatments, the protocols we've developed through the evidence that's out there and also our clinical experience of several decades now. If you combine all of our experience treating foot problems just like this, everyone's a bit different, and you can imagine when you do something every day, you get a good understanding of what does or doesn't cause the pain and a treatment that can help it. So now the good thing about this problem is that it usually responds really well to treatment. So if you can reduce the load on that nerve and use treatments to stimulate a healing response and reduce inflammation, within a month, people are usually feeling a lot better than they've been for months or years. So it's a problem we love to see. Okay, well Esther, I reckon that's enough for everyone. They're experts now.
Yes.
So thanks for watching. We'll talk to you another time.
See you.
Bye.
Bye.